My name is Dr. Feather. You're here for an ear examination, correct? Okay. I'm going to be doing a thorough evaluation of your ears to screen for any problems such as hearing loss, ear pain, lumps, discharge, issues in the ear canal, eardrum, middle ear, infection, excessive earwax, and even foreign objects like a bean or a bead. I had a red bead in my nose once when I was little. I put it there. My mom didn't know until about a week later when I turned into Rudolph and my nose swelled. I had to go to the doctor and have it removed from my nasal passage. It's part of the reason I became a doctor myself. So if you have any beads hiding in your face, I will be happy to help you with them. Okay. Relax. This is easy. Which is your better hearing ear? And have you been experiencing any pain or tenderness as of late? Okay, can you give me a smile? Big one. I'm checking for facial weakness. It's a sign of ear disease. And because I like to see you happy. Okay, I'm going to palpate your ears and the area around them. So I'm just going to come around your side. I'm going to get very close. Just palpating the area around your ears and the ear. Checking for tenderness, swelling, nodules, and firmness. Okay. Very good. Excuse me. Palpating the area around the ear. Just gentle pressing the ear itself. Does that hurt? Checking for tenderness. Swelling. Nodules. And firmness. Okay. Very good. Now, before I continue with the rest of the examination, I would like to show you what I'm going to be doing using this ear model. So please have a look. So this is a model of the human ear. turn it for you. So here we have the helix, the antihelix, the antitragus. Your tragus would be right over here. This is your lobule, or your earlobe. Your concha, it's right in here. And if I turn it back for you, over here is the tympanic membrane, which is your eardrum. Let me show you what a healthy eardrum looks like. So right here, that's what a normal eardrum should look like. You can see the opacity. It sort of looks like a little seashell. Nice and clear and even. This is what it looks like with an ear infection. You can see that it's inflamed. The opacity is very different. Over here, this is what a perforation would look like if you had a tear in your eardrum. We don't want that. And this is if you had an ear tube, but for now we're looking at these three. Normal, infected, perforation. So for your examination, I'm going to examine the external parts of the ear, and then I'm going to take a tool called an otoscope. It's an instrument with a light, a magnifying lens, and a funnel-shaped viewing piece called a speculum to look inside the ear canal. Turn it on. Now we have a light, and I'm just going to be shining that light inside the ear onto your tympanic membrane to make sure that it is healthy. Just like that. I am also going to use a little rubber bulb to puff some air into your ear canal and hit the tympanic membrane so I can assess how well it moves when pressure inside the ear canal is changed. It also helps me determine if there's any problems with the eustachian tube or fluid behind the eardrum. Do you use Q-tips inside your ears? In the future, don't insert Q-tips into your ear canals. Allow me to show you why. Let me get what I use for my younger patient. Alright, so I have filled the ear with some floam earwax. Your ear canal makes wax, or cerumen, for a purpose. The cerumen in your ear waterproofs the canal and keeps water from going in and getting stuck. Sort of like wax on your car would work. If you clean your ear with a Q-tip, that strips the wax away and lets the water stay in. Cerumen is also a natural antibiotic. It's naturally acidic and it prevents infection in your ear. So if you take away the wax, you're more likely to get a swimmer's ear infection. The third reason that you shouldn't remove wax with a Q-tip in particular is that at the end of the ear canal is your tympanic membrane, or your eardrum. And the eardrum is much closer to the outside of your ear than you might think. If you put a Q-tip in your ear so the entire cotton has gone in, you're probably touching your eardrum. The eardrum is very delicate so you can puncture it with a Q-tip. I've seen that happen many times. The other reason is that if you touch the eardrum, you press on the little bones of hearing, the hammer, the anvil, and the stirrup. They're the tiniest bones in the body, and they are attached to the tympanic membrane. If you press on those, it sends shock waves into the inner ear, and the inner ear is responsible for hearing and balance. The more common thing that happens is that the Q-tip is exactly the size of your ear canal. So when you put it in your ear, you push the wax in deeper and it gets stuck, and then you have to get help to remove it. Cerumen, or earwax trapped in there, also brings with it bacteria, fungus, viruses, potentially leading to pain and infection. Let me show you. So pretend this is your Q-tip. Here's your ear. There's your wax. You push it in to clean it, and you are just impacting the wax in. Then your ear makes more wax. You go to clean it, you push more in. All that wax is getting impacted in your ear and on your eardrum. So you don't want to do that. Alright? Not everyone gets a biology lesson when they go to the doctor, but I like it when my patients understand why I make the recommendations I do. I could just tell you why you shouldn't use Q-tips, but I think this way is more convincing because you can see for yourself what happens. Okay? Shall we get started with the rest of the exam? Okay, so now we're going to start with the inspection step. Please pull back any hair that might obstruct my view. You get purple gloves today. I'm just going to come around your side. And I'm looking at the structure and coloration of your ear. I want to make sure there aren't any lesions, scars, or defects. Looking behind the ear and at the pinna. Now I'm going to pull the pinna up and back gently and insert the speculum behind the tragus and have a look. Shouldn't hurt. Just taking a look. Very good. Now I'm going to blow a gentle puff of air into your ear. One more time. Just to see how it interacts with your tympanic membrane. Okay. That should have been painless. So please let me know if anything feels uncomfortable. I'm going to come around this side now. Looking at the structure of your ear, the coloration, making sure there aren't any lesions, scars, or defects. Behind your ear and at the pinna. Okay. I'm going to pull the pinna up and back and have a look. Okay, and here comes the air. Gentle puff. One more time. Okay, now it's time for the whisper test. So I'm going to come around the side again, standing off to the side so that you can't read my lips. And I'm going to obscure the sound from one of your ears by pressing against your tragus. And in the unobscured ear, I'm going to whisper a handful of words. After each word, I want you to repeat the word back to me, okay? Okay, so I'm going to obscure your right ear. Garnet. Rabbit. Jasper. Candy. Ruby. Ketchup. Sapphire. Okay. Other side. Going to obscure your left ear now. Wayward. Acquired. Brilliant. Kitten. Sheepish. first is the Weber test. It distinguishes between conductive and sensorineural hearing. And I have this tuning fork. I'm going to strike it and stick it right in the middle of your head. And do you hear it better in one ear or the other, or the same in both ears? Okay. Now we have the Rini test. So I'm going to place the vibrating tuning fork on the base of your mastoid bone. And I want you to put your finger up when you can no longer hear it. Can you still hear it? Okay, put your finger up when you can't hear it. Okay. Other side. Can you still hear it? Okay, put your finger up when you can't hear it. Okay. And that's it. You are all done. You have some great ears going for you. The associates at the desk will have everything you need, so please stop there and check with them before you leave, okay? Never hesitate to give us a call should you need anything. We will make sure that you are well taken care of. Okay? Have a good one. Bye.